most people are doing the best they can. Not everyone, but most people do the best they can. And when you bring that positive regard, then even a parent who's abusive to a child can be understood with empathy and compassion. So that many parents who themselves are providing the terrifying experiences that lead to disorganized attachment have themselves experienced all sorts of trauma and loss. And if we just look at an example, let's say a child is asserting herself of not wanting to have her father brush her teeth, let's say, and the father himself was the unfavored child and was beaten as a child when his siblings weren't. And he gets an experience now as a father where the child says, "You're not going to brush my teeth, only mommy's going to brush my teeth." And he says, "No, I'm going to brush your teeth." When the child says, no, it's mommy, a couple of things are going to start happening. The kind of memory that's embedded in our nervous system that isn't woven into a narrative of who we are. So in this guy's case, the feeling of abandonment by parents because they favor the other siblings, the feeling of terror of people coming after you to beat you in general, but especially when they're supposed to be protecting you. All that kind of betrayal, humiliation, abandonment, that can be embedded in what's called implicit memory. It's the emotional, perceptual, bodily memory, sometimes behavioral memory. It does what's called priming the brain for readiness to act. So at this moment, when his 2-year-old daughter is saying, "Mommy's going to brush my teeth, not you," this father's brain, if it has unresolved trauma, which in this case we're describing, the implicit memories will become activated. Now, at that moment, he could go down a couple of routes. One is purely reactive, which he feels humiliated by his own daughter. "I should be a competent father, let me brush your teeth." She goes, no, you don't know how to do it. I can do it. So that sense of incompetence as a father brings up humiliation that then resonates with the humiliation from his own childhood. So it can trigger that directly like that. The mirror neuron system of the father can also pick up the anger of the daughter, because it goes both ways. So the father's mirror neurons are soaking in like a sponge the daughter's anger. "You can't brush my teeth," and she's showing this anger. That's going to trigger in a mirror neuron way his own anger. So now he's got humiliation, abandonment, betrayal. The daughter gets more and more angry at him for his insisting, and maybe he grabs a toothbrush and tries to start, brushing her teeth, and maybe she bites his hand, or who knows what's going to happen there. And it can go extremely quickly from a father saying to his daughter, "You need to brush your teeth," to within 10 seconds, a father out of control. And the out of control are all these activations of implicit memory, all these mirror neuron soaking in of present emotional resonance with the daughter. And then because he has a history of disorganized attachment, this father, if he hasn't worked it through in therapy, he will be prone to the low road. Now, once the low road starts to happen, of course, with all this implicit subcortical memory being activated at that moment, all the subcortical resonance of the mirror neuron system happening at that moment, it shuts off prefrontal functioning, and that what it's going to happen is he is going to be letting loose an evolutionary onslaught of, in one case, if he collapses in hopelessness, he may just start crying and fall down on the floor and scream. He may get fearful and just run away. But even as likely is he'll get angry and hit his daughter. That he'll be so enraged at the assault on his sense of self, the cortex is offline, that he will become not only verbally abusive, but potentially emotionally and physically abusive to her.